capillaries. What are those? So for arteries, we already said, what is artery? Artery, we said it's red and it carries oxygenated blood. Usually artery, you cannot see it. It's much more deep, okay? Veins, yes, we can see the superficial veins, okay? So for the arteries, they are thick, and they have 3 layers. The outer layer, it's fibrous, it means it's tough, hard layer. The second layer, it's muscular, to pump the blood. And the inner layer, it's called endothelial layer. What does it mean, endothelial? It's just a type of layer that gives smooth structure from inside. Same, for example, if I want to walk from here to there, or if I will put soap and water and I will slide. So the endothelial layer, it's the same. It will make the blood slide much more easy, okay? Okay, if you go more down, you will find that for arteries, any artery that will be far from the heart, like the arteries that you have it in your legs, the second muscular layer will be thicker. Why? Because it will pump for more distance. So the arteries that are more close to the heart, like the arteries in my arm, the second layer, the muscular layer, it's thinner. But the arteries that will pump for more distance, like the legs, feet, it will be thicker. Why? Because it will pump for more distance, okay? The second blood vessel you have, it's the arteriole. Arteriole, it's the small arteries. So for the arterioles, usually this type of blood vessels, they work when you want extra blood. What does it mean? So now, for example, I am exercising. I need more blood to go to the muscles, to give more oxygen to the muscles so I can perform better. My muscles can contract better. That's the time arterioles will work. Same when you are eating. You want now the stomach to digest food, right? So arterioles will start contracting because there is an organ that needs more blood supply, okay? So arterioles, usually they work under pressure. Extra work, okay? They want extra work. But they are very similar to the arteries. Again, they carry oxygenated blood. Again, they are much more thicker. Same thing, okay? On the right side, page 89, up, you have general characteristics for the arterioles. Some hormones, they make the arterioles contract. Like what hormones? Adrenaline and noradrenaline and vasopressin. These 3 hormones make the arterioles contract. Okay? The third type of blood vessels we have are called capillaries. Capillaries are the smallest blood vessels in your body. What are capillaries? You know when you do fillers, Botox, small blood comes out, you put cotton, it will stop. This is only hitting the small capillary. It's not same as when a person is doing surgery and they will hit artery. A person will bleed, they cannot stop it. It's much more dangerous. So capillaries, those are the smallest blood vessels in your body. Sometimes you take vaccine, small blood will come out, they will put cotton, plaster, it will stop, okay? So for the capillaries, they are only 1 layer of cells, very thin. If you go down, you will find the function of the capillaries. So capillaries, we have them everywhere in our body, except 3 places, except deep brain and hyaline cartilage. What is hyaline cartilage? It's type of cartilage between your joints, and epidermis. So these 3 places we don't have capillaries. We have it in the dermis, not epidermis, okay?
In fat tissues.
Not in the fat tissue. You have it in the dermis, the second layer, okay? Where you have the hair follicle, you have the sebaceous, okay?
Compartment of yes.
Yeah, of course you have it in the fats, of course. But no, we have 3 layers, epidermis, dermis, and subcutaneous. Yeah, of course in the fat we have also. When they do liposuction, how much blood comes out. You can see. But we are talking about epidermis and dermis. Epidermis, we don't have anything. But dermis, we have. That's why I was saying when you are doing fillers, Botox, some blood is coming out because you're putting it in dermis, not epidermis. Okay? The fourth structure is the venules. Venules is the small veins. Same as the veins, they carry deoxygenated blood. Okay? Next page we have the veins. Veins are also having 3 layers and they are much more thinner than the arteries, and like we said, they carry deoxygenated blood. So here you have a small table, the difference between arteries and veins. Also something to differentiate artery and vein. So for the arteries, they have small lumen. What does it mean? Same as this water bottle. This water bottle, the opening is small, but for this cup, the opening is large. So the vein, it's like this. The artery is like this bottle. So for arteries, they have small lumen or small opening. For the veins, they have large lumen. Like we said, for the arteries, they transport blood from the heart to the body. For veins, they transport blood to the heart, like the 2 main veins in the body. Okay? For arteries, they carry oxygenated blood. Veins, deoxygenated blood. For arteries, they have muscular layers, same as the heart. This is what makes the blood walk in the arteries, the muscles, the pumping of the muscles. For the veins, what ensures the passing of the blood is the valve. That's why sometimes we get these blue things here, right? Blue, like spider veins, yeah? Why is this happening? Because the valve is not working properly. So instead of the blood going only in one direction, it's starting to return back. That's why you get these blue things. So in arteries, what is making the blood pass? It's the muscular layer. In vein, it's the valve. Okay? So again, here we spoke about arteries, arterioles, veins, venules, capillaries. Arteries, we said that it's thick and it has 3 layers: outer fibrous, middle muscular, and inner endothelial, to make the blood pass easily. Endothelial layer, we just imagine it same as when you put soap and water on the floor, you will slide. Endothelial layer is very similar to that. For arteries, we said that if artery is far from the heart, the second muscular layer will be thicker. If it's close to the heart, the second layer will be thinner. Okay? Arterioles, we said what about arterioles? We said arterioles, they work under pressure. And there are some hormones that can affect the arterioles. They make the arterioles contract. The third is the capillaries. We said capillaries is the smallest blood vessels. And we said capillaries, we don't have it only in 3 places. We don't have it in the epidermis, we don't have it in deep brain, and we don't have it in the hyaline cartilage. Cartilage between your joints. Okay? The fourth blood vessel was venule. Venule, we said it's very similar to the vein. It's carrying deoxygenated blood, it's blue, and it has a large opening, large lumen. Remember this and the small bottle, okay? The last thing is the veins. We said veins, they transport deoxygenated blood, it's blue, and they have large lumen, and we said that they have valve, door, to open and close. Page 91, this is not important. This is all the arteries and the veins in your face. It's not important for you to know it. And this is the arteries and veins that you have it in your trunk. In the next page, you have the arteries and the veins that you have in upper limbs and lower limbs. It's not important for you to know. Maybe you can get one question. So I think it's better for you to study bones and muscles better than this. So don't fill your head. Maybe also you will not get any question. Okay, maybe in SIGTAC, one question. Okay? Here, the next page,
Blood pressure.
we have the blood pressure, page 93. What is blood pressure? Blood pressure is the force that the blood will do on the walls. What does it mean? So when you are in a crowded place, you want to pass by, what you will do, you push, so you can pass. This is the same thing the blood is doing to pass in the blood vessels. It's pushing in the walls of the blood vessels so that it can pass. So it's the force that the blood exerts on the walls of the blood vessels. Okay? On the right side, we have factors that affect the blood pressure. Same as we had some factors that affect the heart rate, blood pressure also we have factors. The first factor is the cardiac output. What does it mean, cardiac output? The volume of the blood. What does it mean, volume of the blood? So now when I'm exercising, there is more blood inside my blood vessels, right? That's why blood pressure increases. So the volume of the blood, how much blood now is in my body, that this can affect my blood pressure. The second factor, it's the resistance offered by the arterioles. What does it mean? Like we said that we have some hormones that affect the arterioles. So if these hormones are working, the arterioles are contracting. If there is contraction, then there is less space for the blood to pass. So also this is a factor that can affect the blood pressure. What else? The viscosity of the blood. What does it mean, viscosity? The thickness. Some people that have high cholesterol, high fat, the blood is not like fluid. It's much more thicker, like a cocktail. You know, the cocktail that you drink, the juice. So the blood is much more thicker. Of course, this also affects the blood pressure. If it's much more fluid, then it's easy for it to pass. If it's filled with fat, it's thicker, it's much more difficult to pass.
When the hemoglobin is
Hemoglobin also, yes. The last thing that affects the factor of the blood pressure, it's the elasticity of the artery wall. What is the elasticity of the artery wall? We said that the arteries, they have 3 layers and the middle was muscular to pump, right? To do like this. If this muscular layer, it's not elastic, it's more rigid, then the blood pressure will increase. Because the blood, when it's passing, there is no flexibility, it's rigid. So some type of diseases like atherosclerosis, this is a very well-known disease. Person will have the arteries stiff arteries. So they have more blood pressure, higher blood pressure, okay? If you go down, you will find that the blood pressure, as you know, it's 120/80, right? So it's 2 readings. 120, it's the contraction, and the 80, it's the relaxation. Systole and diastole. So for now, the new research, they are saying the good blood pressure, it's 100/70, which I think is very low. But maybe because this book is from UK, so the research, it depends on them. But of course, 100/70 is very low. 120/80, it's perfect. Okay? So like we said, systole is the contraction, diastole is relaxation.
depends of age.
Depends on the age, of course, yes. Next page, page 94, we have how blood pressure is measured. So the machine that they measure the blood pressure with, it's called sphingomanometer. So put a line under the name of the machine. So how they check your blood pressure, they put the cuff on your arm and then they increase the pressure to 140 millimeter mercury. And then they will start opening. The first sound they will hear, this will be the systole, the 120. And then this sound that they hear will start disappearing. When it will disappear, this is the 80, the diastole, okay, the lower. So here on the right side you have causes and effects of high and low blood pressure. It's not important for you to know. Just know that high blood pressure, it's called hypertension, and low blood pressure is called hypotension. Okay?
Mm-hmm.
Any questions for this part? So what are the factors that affect the blood pressure?
Hypertension and hypotension.
Yes. What are the factors that affect the blood pressure? Page 93. The first one, we said cardiac output, the blood volume,
Yeah.
how much blood is in the body. The second one is the resistance of the arterioles. We said arterioles are affected by some hormones. If these hormones are there, then arterioles will contract and blood pressure will increase.
And the blood volume.
We said this one, it's the first one, same. Cardiac output, blood volume, it's the same.
The muscle of the
Viscosity, we said that the thickness of the blood itself, if a person has too much fat, then the viscosity of the blood is thicker. The blood pressure will increase. The last one was arteriole elasticity. So if it's elastic, the blood pressure is okay. If it's more rigid, then the blood pressure will increase. Okay? Okay, last but not least, we have the blood clotting. Should I remove this?
Yeah.